we're gonna basically reconstitute this vial and inject into this bag. Okay, we need 3 mils is what we're gonna do. We're gonna reconstitute with, well, actually we're not actually doing it reconstituting, but we're gonna reconstitute the vial, inject into the bag, but this is a chemo.
Okay.
Okay, so remember, as per NAPRA, you can only fill a syringe 3/4 of the way, 75%, right?
Mm-hmm.
When it comes to chemo. So which means you have to think about that. If let's say the dose is 4 mils, are you going to use a 5 mil syringe? No, you're going to use a 10 mil syringe.
Okay.
Because 75% max, okay? And then also, to vent, you need a filter, hydrophobic 0.22 mil hydrophobic filter, okay? Okay. So now, first thing we're going to do is we're going to prepare, get our bag ready. So when we're going to inject into it, it's ready to go. So I'm going to take my bag and I'm going to swab it. And I'm just going to place it out of the way. The reason why I put my port facing backwards is because if I put it like this, I might shadow it. And then I'll have to re-clean it, right? So just put it backwards like this.
Okay.
Then I'm going to get my vial ready. I'm going to remove the cap. I'm going to swab it. Let it sit while it's drying. I'm going to assemble my venting device, which is the chimney, with the filter, okay? So I'll take the 1 mil syringe, throw that in the garbage. I'm going to take my filter. So when you open this guy, the lure lock part, the part that goes on the syringe, will be up.
Mm-hmm.
Okay, so that's the part that's going to be up.
Mm.
The only thing with this is if you open it and you do this, it's going to fall out. So that's just how they come, okay? They come very loose in there. So when you open it, hold on to the sides so it doesn't fall out. Okay. Okay, then you're going to put it on. Like just it twists on like a syringe, like a needle.
Mm-hmm.
That's why I have it on the right side with the needles. You put it on, that's going to go in the garbage. Then you're going to grab your 25 gauge needle because that is the smallest needle. So it allows air to come out without putting a big hole in the vial because you don't want as many holes because if we're using negative pressure, air can sneak in. Okay, you're going to remove the plunger because air needs to come out and this is plugging the hole. Remove the plunger.
Mm-hmm.
Remove the cap. Place it over here. We're never going to use that again. And you're going to place your device right here into here, okay, with a little bit of space.
Mm-hmm.
So we're going to pretend to reconstitute it. We're not going to actually do it, so reconstitute it, right? Then we're going to remove our venting device, and we're going to place it in the sharps container just like this. And the reason why is because it's chemo. We don't recap with chemo because most of the injuries and exposures will happen when you're recapping. You can poke yourself, and you don't want that. So they avoid that because it's safer, so you just throw it like this in the sharps container, okay? Then because it's chemo, anytime you remove a needle out of the vial or out of a bag or out of anything, you need to decontaminate the port in case any chemo got on it. So you're going to use a swab, and you're going to remove anything that's on there, and then throw that in the garbage, okay? Then you're going to swivel and swirl because we're, reconstituting. Make sure it's dissolved, okay? Now, because we've fiddled around with it, looked at it, brought it upside down, we shadowed the vial. Now, because we shadowed the vial, we have to disinfect it. So you're gonna use an alcohol swab, you're gonna disinfect it. While it's drying, you're gonna assemble your 10 mil syringe with a 21 gauge needle. That's the one that you use for chemo always, 21 gauge. And we're gonna use a negative pressure technique to withdraw 3 mils. Why is it called negative pressure? Because it's referring to the vial. We want negative pressure in the vial. And the way to do that is to give it less than what we take out. So if we're taking out 3, we're going to give it less than that. We're going to give it about 2.7-ish. Okay?
Yep.
That's all we're giving it to keep the negative pressure in there. Remove the cap.
So if you want like 3 ml, then we will be doing always less.
Always less.
Yeah.
Negative pressure, always less.
Always less.
5 mils, less, like 4.7.
Okay.
6 mils, like, I don't know, 5.6 or something like that. Yeah,
okay.
something along the line, okay?
Yeah.
So then you're going to grab the vial and you're going to bevel up so the tip goes in first. Lean it on the vial at 45 degrees. Put a little bit of pressure and go in at 90. My needle is dull, okay? Flip it over. Now, if I pull, so we want 3. The first thing you do with negative pressure is always pull. If I pull it down to what I want, 3, I'm already putting a little bit, there's already negative pressure in the vial, and that's exactly where we want to keep it, okay? But we're going to go past that. We're going to go to about 3.4 so the liquid comes in, and we're going to go only up to 3, and that's it, right? So 3.4, 3, and you're going to continue this until you fill up your syringe with the required volume, which is 3, okay? Remove the bubbles, and then I'm not going to fill it up, okay? Now, you're going to place it back down. You're going to keep the vial on the surface. Now we have to remove the needle out of the vial, okay? You're going to actually grab it like this. Put your thumb underneath the plunger. Don't actually pull, but apply a little bit of pressure so there's a little bit of a sucking motion without putting a lot of bubbles in, okay? So pull a little on the plunger and then just remove the needle. Because the whole test is basically to make sure you have a dry vial and a dry needle. Okay? Because with chemo, you're not only protecting the product by using aseptic technique to make sure it doesn't get contaminated, but you're also protecting yourself from exposing yourself to anything that's hazardous. So that's what we're also testing for. So there's different tricks that you can do to protect yourself. So that's how you remove it.
So the pressure on the plunger, not.
Yeah. So you put your thumb underneath, because if you put it on a push, you see how when I push it comes out.
It'll come out.
Yeah, and I'm not even pushing. I'm just putting my thumb on it. So the same, like I'm not even pushing.
Right? Yeah, a little bit.
So I will do underneath the plunger.
So it doesn't go back.
Exactly. So underneath we'll do the opposite. It's not actually gonna pull, but it's gonna, like without you even doing anything, it's pushing. And this is gonna do without even doing anything, you're kind of pulling in. Okay? So like you're not actually gonna put lots of bubbles in. You're just gonna put your thumb underneath and just apply a little bit of pressure. Okay? Then you're gonna take. This is a big no-no. Then you're going to take your bag, and you're going to inject into your bag, straight in, right? And then you're going to remove your thumb off the plunger, and you're going to count to 1, 2, 3, and then that goes right into the sharps. We're not recapping because it's chemo. We're going to swab our bag because we're going to decontaminate the port because the needle just came out of it. Decontaminate, okay, garbage. Then we're going to seal the port. So the seal is it's like a sticker. It comes off like this. The white part is not sticky, and the silver part is sticky. Okay? You're going to put it on the non-sticky. It's going to go on the port. You're going to close it like this, and it'll stick to each other.
Okay, but we have to remove the whole part, right?
You'll have to remove the whole thing.
Then we have to put. Okay.
Exactly, yeah. Then you're going to decontaminate your final product because, I had some spillage. Obviously I should have changed it and got rid of it, but I'm just saying. So we're going to assume that this is contaminated from air or any particles in here. So and the bag was laying on it, we need to decontaminate it. We're going to get rid of all the hazardous stuff. So you're going to hold it. So my gloves are dirty, right? Bag is kind of dirty. We're going to take our wipes, and we're going to wipe, let's say, the bottom of it. Okay? I'm going to throw that out. Now this part is clean. How do I touch that part? I need to have a clean hand. So I'm going to remove this dirty glove.
One gloves.
One
I'll
glove
be wearing
will
2 gloves.
But not for you don't need to. Your hand will be your second glove. You'll see right now. Okay? So you're gonna remove it. So you're not gonna put your dirty glove onto a clean glove underneath. You're gonna dirty to dirty. Remove it. Okay? We're gonna pretend this is now clean. Now I'm gonna clean hand or clean glove. Clean product, I can touch it. I'm going to grab the other wipe, clean that, okay? And then I'm going to go clean thumb underneath because that's clean. This is dirty. We don't want to contaminate. And you're going to remove this second glove.
Yeah.
Then you're going to label it, put it in the bag, and you're done.
Label inside the hood
Label
itself.
inside the hood, yeah.
And
the label is going to come in the